Hello everyone, my name is Kamisha Sumlin. In today's presentation we will be talking about which road will you take. As you can see here in our picture, we have a road that leads down to two different paths. So we're going to be discussing EHR and HIE. This presentation is for managers and we'll be discussing the benefits of going down the right road. What is an EHR? So an EHR is an electronic health record, and it is a digital record of patient health information. This information contains sensitive information, so it will contain information about the care that is received in any type of care delivery setting. Information is personal and is specific to each patient. So information contained will be date of birth, full name, address, services received, physicians, what facilities. Those type of information you will find with them, or even, of course, the medication that is prescribed, the diagnoses. This information can all be found in an electronic health record. Using the electronic health records helps to ensure the safekeeping of patient health documents and avoids things such as damage to files or the misplacing of important information. As you all know, before health records were moved to electronic systems, as you can see in the picture here, there is a picture of a computer screen, and in that computer screen there is a file folder. And so now we're storing all that patient information within that file folder in an electronic format. Most organizations or healthcare facilities previously stored information in folders in a file cabinet or this huge room that had lots of files for all patients. Um, the downfall to storing information that way is you could possibly lose files. Files could get misplaced, as in they could be filed in the wrong patient's folder, or they could be damaged. They could be lost. They could get wet. If any type of damage happens to the building, then that information is lost. So how does this work? So in the very first slide, we showed the road with the two paths, and we mentioned the terms EHR, which is electronic health record, and now introducing a new term, which is HIE, which stands for Health Information Exchange. The two of those systems combined gives you more efficiency within your organization. So how does this work? An HIE is a way to exchange information or patient data or patient information amongst multiple facilities and multiple healthcare providers. So as you can see in the picture here, we can exchange information through a hospital to your primary care physician, to the local health department, all through this cloud that's going to be containing that health information for each of those patients. So the benefits of using an EHR and an HIE. So for example, as with any new device that you get or any item you purchase or any new system you're interested in buying, each individual consumer will not be affected or impacted in the same ways, right? So therefore, you'll want to weigh out the pros and cons or weigh out the options for your facility in regards to would this be a good decision to implement the software or not. Some factors you'll want to consider are size, the size of your organization. So whether you are a small nursing home or whether you are a large hospital, the type of services that are offered there, and also the patient population. So this is a small clinic that only sees 50 patients a day. It may be easier to, store your files through an EMR or store your files in some other type of method. But if you have a larger facility, then using an EHR and HIE could be more efficient for you. Some other factors to consider are going to be time commitment. So how much time is it going to take to implement this new software? How will it affect the improvement of care? Because of course the overall goal in healthcare is to be constantly improving the care. How will it affect our efficiency? and also what financial costs are going to be associated with it. Nothing is free. So it's a new software. We're going to be recommending it, telling you all the benefits and all the pros of why you should be using EHR and HIE. But you also want to make sure that the cost to implement this new software is going to be included in the budget for your facility. So to help us determine, why we're going to be wanting to use this EHR and HIE, we have to first kind of take a step back and dive into a term that's called meaningful use. So meaningful use is an incentive program that was implemented by the United States federal government. And what this program does is it lists the requirements that a provider must follow when they're using an electronic health record. So some of the requirements are that an EHR must be implemented to improve the quality, safety, efficiency, and reduce health disparities. So of course, again, we're trying to overall improve that care, improve more efficiency, and make sure that patient information is always safe. We want to be able to engage their patients and families in their health. So it also provides an easier way for patients and their families to be able to access their health information. We're going to be improving the care coordination. So the coordination between one facility and the next facility, making sure that there's no delay in receiving information. You're waiting on your primary physician to fax the paperwork to the hospital so you can receive care. We want to make sure that nothing is delayed and that care is improved. Improving the population and the public health. So again, we want to overall make sure that if we can improve care at one facility and if we can convince other facilities to also use an EHR and an HIE, then it will overall help improve the care within our population. And then we want to ensure adequate privacy and security protection for personal health information. So laws such as HIPAA come into play here. We want to make sure that patients are receiving the care they need, but they were also protecting their information. So you're probably wondering, how is care going to be improved by implementing a new EHR system? Well, one of the first reasons that you'll want to implement an EHR to improve your care will be because you'll have access to clinical decision-making tools. So within the EHR, they usually should provide you some type of tool or suggestions, or you'll be trained by the experts for the EHR on best practices to use within your facility. You'll also be able to get information and share it amongst other providers or within other organizations within the care settings, right? So therefore, again, kind of going back to the example I mentioned with someone in the hospital needing health records from their primary care physician, or someone been in a local clinic, or even out of town in a different state you want to be able to have access to your information so that you can overall improve your care. Without that information in your EHR, in your electronic health record, you can see another provider, and because they don't know what medications you could possibly be allergic to, and they don't know what things you have been diagnosed with in the past, that all plays a part in the care they can offer you at that moment. Versus if they had your EHR, they can take a look at your medical history and be able to better make a decision of how to proceed with giving you proper care. And then, of course, same concept with the ability to examine and analyze the quality of care metrics, among others. So, how can we improve efficiency? So operations can operate more efficiently and generate more revenue when EHR is used to improve its billing functions, right? So within an EHR, again, you're going to be trained on those best practices. Of course, the software company cannot tell you how to bill out your claims, but they can offer you best practices, give you guidelines of what certain payers, such as Medicare and Medicaid, are going to be accepting, what things they typically reject. You can do things like, edit analysis, looking at your information that you're sending out and billing, so you'll be able to kind of edit and clean up those files prior to being sent out, which will ultimately generate more revenue. There are things that come into play, such as timely filing. If it takes you too long to file a claim to a health provider, they will not pay the claim if it's past a certain date. Or if it's been rejected so many times, it could possibly affect them paying the claim. So if you use an EHR to clean up those claims when you're doing the initial billing, get that claim sent out the first time clean, then you'll be able to ultimately generate more revenue. Another way to improve efficiency is you're going to be getting accuracy in coding for your services, which ultimately will help to save time and resources. So if you can, again, have your claim files coded correctly and have some type of EHR system that's going to be checking to make sure there's no errors based on the standards and the guidelines that most payers are going to be looking for, we can fix that on the front end, again, to help save time and to help save resources. So one person is not having to constantly rework the same claim. They can work that claim the first time, get it out the door, and now proceed to work in the next claim. Another reason to improve efficiency will be to eliminate third-party companies. So if you have a billing system within your EHR, within your facility, then your billers, your staff are going to be the ones that are going to be generating these claims and sending them out to the payers, which eliminates the need for using a third party. A third party is not there, they're not with the patients, they don't know your practice is at your facility, so therefore they're doing it based on a standard guideline that they've implemented, which could sometimes cause errors. So eliminating that third party will reduce those errors and give you a more streamlined process to use within your organization. So what does all this cost? As we know, the world revolves around money. If you want to implement a new system, you must be willing to pay some sort of cost in order to implement this software. So soft costs you should consider when you're creating your budget for your new EHR system. How much is it going to cost to get the software licensing? Any maintenance for this software? Any consulting or training fees? So would I have to pay the EHR staff of that new software to come to train my staff for me, or will I be able to train my staff for free? What labor, including overtime. So maybe the staff has to work later to train to avoid any interruptions in their normal daily activities. Any hardware we're going to need. Will we lose any revenue in the process? Will you lose any productivity in the process? And also, will you possibly see a decrease in patient visits throughout implementing this new software? So financial gains after implementation. So now that we've implemented it, what can we see as far as the financial gains? We've talked about efficiency, we talked about improvement in care. So what can we see on a cost perspective after implementation? Well, you'll be able to get enhanced service delivery. You'll see reduced costs, hopefully. You'll see increased revenue, increased efficiency, increased quality of care, the reduction of waste. So we're going to be not seeing as many things that are going to be having to get written off at the end of the year. You're going to see that reduction in medical billing and coding errors. And then you'll also be able to get some reporting tools that help you improve research. So you can see where the errors are, where we're going wrong, and what we need to improve. So adjusting to a new system, you want to kind of weigh out your options of how is it going to affect my patients, how is it going to affect my staff. Potential issues could be an interruption in normal daily duties for your staff. So are they going to have to stop doing their normal duties to come and train for this particular software? Or will the patient be affected in any kind of way? So will the patient receive a lack of care because we're training for a new software? And then, of course, the question comes across everyone's head. What if I don't like this new system? What am I going to do? Well, ultimately in EHR, as I've given you all the benefits prior to this slide, you can see that you most likely will like using an EHR system. So I doubt if you'll have to worry about that last comment of what if I don't like the new system. Lastly, are you using an EHR? If you're not using an EHR, there are 10 reasons listed here of why you should be using EHR. So things could be your reports are not accurate. Are you having connectivity problems? Is your software just old and outdated? If you just want to have a more updated, efficient way to do healthcare billing and practices, I would recommend using an EHR and connecting it with a health information exchange system. This concludes this video. And this video was created and narrated by Kamisha Summer. Thanks.